We've had a really inspiring day here in southern Zambia. It's been quite incredible to go and see one of the health centres that we've helped put together, that's been funded by WaterAid. Not only brings water, but it brings a really clear idea of how to keep hygiene. The thought that's gone into the way that waste flows out of the building, as well as the clean water, and hearing about the much better outcomes for young mothers and babies who are coming in to the health centre to deliver their babies for the very first time is really, really inspiring.
Our first visit in the morning was to Chisekesi Community Health Facility, and we had the wonderful opportunity to meet the community that actually benefit from the facility. They told us about how non-existent water and sanitation facilities were at that health facility before WaterAid stepped in, and what they now have is an amazingly well thought through, planned and now maintained a labour ward and outpatient clinic, all with excellent water, sanitation and hygiene. You know, I feel full of emotion. I'm so overwhelmed to see how thankful and grateful the community were for the support they've had from WaterAid, and incredibly proud of us at WaterAid for all that we've done for this and many other communities we serve.
I think in all this, again, what's outstanding is the impact that the work that WaterAid has been undertaking in Zambia. At Rusungu healthcare facility, the women that we met were very clear in relation to the benefits that they've accrued as a result of the improvement in water, sanitation and hygiene at the healthcare facility. They were able to allude to, increased number of women that are now giving birth at the healthcare facility, and therefore reducing maternal and child deaths that would have otherwise happened if they were giving birth in their homes.
Our second visit was to Nteme to take a look at, firstly, a dam. And I honestly couldn't tell it was a dam, because all it was a puddle of water. That's how dreadful the situation is, the water and drought situation is in Zambia and other neighboring countries.
We took the trustees out to see the dam that the community relied on for drinking water for their livestock. To say that we took them to see a dam is probably an overstatement. Principally, there is no dam because the water levels have gone far below what is even possible to bring livestock to drink from. But thankfully, with the work that we have done through the Nteme project, we've provided a water supply system that has a 50,000 litre capacity, supplying within a 2.5 to 3 kilometre radius of the Nteme community. What does this mean? It means that not only do the households get water supply, but the livestock as well. And there's even an opportunity for small-scale gardening that the households have undertaken in order to supplement their livelihoods. The work we're doing in Nteme is growing work. It doesn't end in this particular community. We are continuing to build new systems and to scale up the model that we have here that reaches the healthcare facility, it reaches the school, and it reaches an additional 79 households around the water system, including their livestock and the gardening services as well.